All right, let's get into it because there's a lot of misinformation out there when it comes to dental implants, and we hear these same concerns and myths all the time from new patients. So today, I want to walk you through the top 5 most common misconceptions we hear about dental implants and set the record straight. Whether you're just starting your research or you've been thinking about this for a while, this should help you feel a lot more confident and a lot more informed. Misconception number 1, dental implants are only for older adults. This one comes up a lot. People assume that implants are only for older folks who've lost all their teeth, and that's simply not true. We see patients of all ages getting implants. Young adults who've lost a tooth due to an accident, people in their 30s or 40s replacing a single tooth or a few, and yes, older adults looking for full arch solutions. The bottom line, if you're missing a tooth or multiple teeth and you want a long-term, stable solution, implants can be a great option no matter your age. Misconception number 2, implants are too expensive and not worth the cost. Okay, let's be real. Implants are definitely an investment, but a big part of that comes from what they're actually giving you in return. You're not just paying for a new tooth, you're paying for something that looks natural, functions like a real tooth, doesn't move around when you eat or talk, and, if taken care of, can last decades. Unlike dentures or bridges, which often need to be replaced or adjusted, implants are a much more permanent fix. And here at Secure Dental, we do everything we can to make the process manageable, whether that's working with your insurance, offering payment plans, or helping you choose the right treatment plan for your budget. Misconception number 3, getting dental implants is painful. Now this one makes so many people nervous, but honestly, the procedure surprises a lot of our patients in a good way. The truth is, getting implants is usually much easier and more comfortable than people expect. Between our sedation options like IV sedation or oral sedation and our numbing techniques, most patients feel very little during the actual procedure, and some even fall asleep. Afterwards, there's definitely some soreness, but we walk you through everything you need for the recovery, including pain management and how to care for the area. Most people are back to work or their daily activities within a day or two. Misconception number 4, implants take forever to heal. Now, healing time can vary depending on your treatment plan, but it's not always a long, drawn-out process. For example, if you're getting a single implant, we typically let it heal for a few months to ensure the implant bonds with your bone. That process is called osseointegration. But you're not just sitting around waiting. You may get a temporary tooth placed while everything heals so that you're never walking around without a gap. And for full arch cases, we can often place temporary arches the same day, which means you leave the office with a brand new smile that day, while your permanent teeth are on the work. So yes, healing is important, but we make sure you're never without teeth during that process. Misconception number 5, if I wear dentures, I can't get implants. Totally false. In fact, many of our implant patients come to us because they're frustrated with dentures. They're usually tired of the slipping, the adhesive, the way they limit what you can eat, and they want something more secure and comfortable, and that's where these dental implants come in. You can upgrade your denture experience with implant-supported dentures, also called overdentures, or go for a full fixed arch that doesn't come out at all. Both options are more stable, feel more natural, and are easier to maintain long-term. Quick bonus myth, I'm not healthy enough for implants. Now this one's a little bit more nuanced, but worth mentioning. A lot of people think that they've had gum disease or other health concerns and that they can't get implants. And while there are some medical considerations, most people are still eligible for treatment. We'll always do a full evaluation, look at your overall health, review your medications, and assess your bone levels to make sure implants are the safe and successful option. Sometimes it might mean a little extra prep work, like a bone graft or a deep cleaning, but we're here to build a treatment plan that works for you. So those are the top 5 misconceptions we hear over and over, and hopefully this helped clear a few things up. Now, dental implants aren't just for a specific type of person. They're for anyone who's looking for a long-term, reliable way to restore their smile and get back to eating, talking, and living with confidence. And if you still have questions or aren't sure if implants are the right fit for you, the next best step is to schedule a consultation with us. We'll take a look, answer all your questions, and walk you through your options. No pressure, just honest advice.